This is Nicole Raleigh from Pharma Forum. I'm at Frontiers Health 2025 in Berlin, where the panel Future-Proofing Health Systems, Equity, Innovation and the Prevention Imperative has just come to a close. And one of the panelists was Moredreck Chibi, who is Public Health Innovation Lead at the World Health Organization and is Regional Office for Europe. Pleasure to speak with you, Moredreck.
Thank you.
So I have one question for you. What was your key takeaway from that discussion?
The discussion was quite dynamic, and I really liked how even the conference, the meeting was evolving from specific innovation and converging towards the innovation ecosystem empowered by countries and also globally, regionally. And this is where I came in as WHO innovation lead. And basically the idea was to try and bring innovators, innovation institutions to say you can work with these global bodies like WHO in identifying public health challenges. And together with your innovation, you can match some of these innovation to address these public health challenges. And as WHO, we can also work closely with member states to address some of what we call systemic scaling bottlenecks, whether it's to do with training health workers to roll out some of the next generation innovation. And this is what we have been hearing a lot about, some of the emerging trends in innovation, and our public health workers normally they lack that requisite knowledge to roll out or implement some of these innovation. Talking of reinvestment models, we're talking about even procurement, innovative procurement mechanism, and even coming up with clinical guidelines that integrate this innovation into routine practice. And this is where the innovators and also innovation institutions can leverage organizations like WHO. And this is now our new sort of mandate through our regional director, Hans Klug, who is really championing reimagining of public health through innovation. And just 2 weeks ago, we had a 53 member states meeting in Copenhagen where they unanimously endorsed a regional strategy on harnessing innovation for public health. And basically what it means is now member states are aligned in terms of harnessing these innovations, and they are actually opening their arms to invite all these innovators to come and co-create, co-design solutions for public health challenges.
Just brilliant. Thank you, Moredreck.
Thank you.
With me now is another panelist from Future-Proofing Health Systems, Equity, Innovation and the Prevention Imperative. And that panelist is Chrys Herrera, who is Head of Health Equity and Access Realization at Merck KGaA. So, Chrys, I have one question for you. From the panel discussion, what was your key takeaway?
Well, I think we need to reimagine what we do as an industry in order to rebuild the trust. We need to think more about how we improve health outcomes and not just innovate medicines. And that really means putting people at the center of everything we do.
Thank you.
All right, thank you.